Good morning, everyone. I'm Binghe Xu from Cancer Hospital, Chinese Academy of Medical Sciences in Beijing. It's my pleasure to present the phase 3 data of Entinostat, a class 1 selected H-DAC inhibitor, in combination with exemestane in patients with HR-positive advanced breast cancer. This is my disclosures. First, let me give a quick introduction to this product. Entinostat is an oral class 1 selected H-DAC inhibitor. It has been investigated in more than 50 clinical trials globally as single or in combination therapies. Its unique characteristic of long half-life allows continuous exposure with once-weekly dosing. This slide shows how this compound works. Basically, Entinostat is designed to resensitive breast cancer cells to hormone therapy. Now, let's take a look at the design patient population targeted on the advanced breast cancer with HR-positive, HER2-negative ECOG score 0 or 1. The treatment continued until disease progression or intolerable toxicity. Primary endpoint was PFS assessed by IRC. Regarding patients' disposition, totally 354 subjects were randomized, in which 235 in Entinostat group and 119 in placebo group. By cutoff data, there were 13 subjects still in treatment group and 14 in control group. 149 subjects had IRC assessed PD in treatment group and 88 PD cases in control group. The baseline characteristics are shown in this slide. All these baseline characteristics are balanced with no statistical significance between the two groups. In our study, we had more patients with serious conditions. About 70% of patients with visible metastasis. 15% of patients in treatment group received more than 3 lines therapies. About 30% of patients were primary endocrine resistant. This slide shows the primary endpoint analysis of PFS in FAST population. Based on 235 progression events as of cutoff data, the median PFS was improved to 6.32 months versus 3.72 months. Hazard ratio was 0.74. P-value was 0.021. In addition, the HR analysis with stratification factors were also significant. This is the PFS in PPS population, demonstrating even better performance in the well-managed patients population. The survival benefit is an important evaluation factor in breast cancer treatment. 89 death cases were connected by cutoff data, which is about 36% of the estimated mature data for OS analysis. Good to see that the vertical dashed line may indicate the potential landmark time point for OS differentiations in two groups. We expect to see good OS results during next year. Regarding the secondary endpoints, the OR and CBR were improved based on IRC assessment. Same analysis was done based on investigator assessment, which showed that the patient benefit was better than the IRC assessed data, especially for CBR, which was significantly improved to 45%. We also did some ad-hoc analysis on DCR and DOR. The interesting finding was about DOR. By the cutoff data, the median DOR was not reached by IRC assessment, but it showed a significant improvement by the investigator assessment to 12.96 months. This slide shows the analysis of PFS in the different subgroups. Hazard ratio across the different subgroups were almost consistent with the overall study PFS hazard ratio. Most of the subgroups analysis favored the Entinostat group. Regarding the overall TEAE for the Entinostat group, the grade 1 to 5 adverse events incident rate was 9%, 25%, 57%, 5%, and 3%, respectively. For the study treatment related AE, for the Entinostat group, the grade 1 to grade 4 AE incident rate was 10%, 23%, 53%, 4%, respectively. Hematological toxicities are the most common adverse reactions as Ad-hoc inhibitor treatment. In our study, neutropenia, leukopenia, thrombocytopenia, and anemia was observed as 73%, 64%, 67%, and 21%, respectively, in Entinostat group. In addition to hematological toxicities, no other safety signals were identified in this trial. So in summary, as a class 1 selective oral Ad-hoc inhibitor, Entinostat was proved in this pivotal study that the combination with exemestane can significantly improve PFS with hazard ratio 0.74 comparing to exemestane alone in target breast cancer patients. The most common adverse events were hematological toxicities that were mostly symptomatic and manageable through supportive care. Lastly, I would like to thank all the patients and their families, investigators, the study sponsor EOC Pharma, and the other participants that were involved in this study. Thank you for your attention. I would like to answer any questions you may have.